Welcome to another episode of the Life in Motion podcast.
The topic today is movement and nutrition, how the DPT and RD Professional Dyad may better serve our patients. Our guest today is Dr. Austin Nguyen, a physical therapist and a registered dietitian, also a CSCS. He is also the owner of Jasmine Sushi and Thai and the founder of Registered Dietitian Approved in Orlando, Florida. Welcome to the podcast, Dr. Austin Nguyen.
Thank you. Thanks for having me.
Please tell me more about yourself and what led you in the path to become both a registered dietitian and a PT.
Cool. Yeah. So, for those who are listening, you might have heard Jasmine Sushi and Thai, right? What's all that about? You're a PT and all this. So the way I kind of got started and to become a dietitian and a PT was starting off in college. I was trying to figure out what I wanted to do. I had no idea why I wanted to become a PT. Maybe some people do. They had, a story of an injury in the past, but I had no injuries. Nothing happened to me. I was just a guy who wanted to know what to eat to become healthier, to become bigger, stronger, and just, be healthy overall because I grew up in an Asian family. So we didn't have much healthy food around growing up, right? No one exercised. And I wanted to do the opposite. So I started to look into courses, do my research online, and I was like, oh, this is cool. Okay, I can learn what things to eat for myself to become healthier, and hopefully I can help my family, and I'll do nutrition. And so in that route, as I was doing that, I decided that I want to become a personal trainer as well because I wanted to learn exercise for myself and then maybe be able to coach people later on. And so as I was doing that, I was, in undergrad learning food, nutrition, and exercise. And I liked cooking and all that too, right? So in that process, one of my jobs was me being a sushi chef in restaurants. And that was one of the things I liked. And then I was also a personal trainer. And the funny thing is that as I was training people at my school, at my recreational center, I started seeing older people with certain injuries, right? Like the first one was, somebody told me she had spinal stenosis and she wanted me to train her. I'm like, oh my goodness, what is that? I don't want to do anything wrong. I want to make sure I don't hurt anybody. So I look it up. I'm like, all right, what's this about? Right. I talked to a friend who's in physical therapy school. And he's like, oh yeah, this is what you do. Work on the core strength, this and that. Make sure you don't do too much things where back bending. And I'm like, okay, cool. And then that kind of got me started in that route, being curious about, all right, what's physical therapy and researching that profession, And so, it started from there. I started seeing some more people with some other past injuries and they wanted me to train them. And I said, hey, you know what? I think it would be cool to kind of continue on and become a physical therapist, work with people with other injuries, and hopefully down the line I could kind of combine my passions somehow. And so I became a PT, and before then, my family over here we decided to open our restaurant. So it's Jasmine Sushi and Thai. It's right across the street where I went to college. So I'm actually going down there today after we finish this podcast episode just to see him. And so, that's how that came about. And that's kind of my little story on how I became a RD and a PT.
Amazing story, right? Because, my heritage is from the Philippines. Yeah. So again, another Asian culture. And it's interesting how I am very proud of my culture, but my eyes are pretty wide open as to nutrition. Some of our stuff isn't quite as nutritious as it can be, regional wise. And I will discuss that again later on about, the regional and ethnic challenges of trying to eat healthy. What I love in your story is how, from your story, how you are a physical therapist after the fact, but your initial passion was cooking, but really your feet are in multiple pools because not only are you trying to help people move better, you can actually guide them on how to eat. And you actually have a commercial venture where those principles can come into play, and how you can safely marry the need of people to have enjoyable food, yet still be fairly nutritious. That's a very good asset to have in the kitchen, I guess, right?
Yeah. I mean, can't say I'm, the world's best chef or anything, but I like to find that balance between, having good food and having it nutritious as well.
Do you have wicked knife skills?
Oh yeah, if you're a sushi chef, you can't cut your fingers off. I wouldn't have made it this far.
Oh, yeah, yeah. 1, 2, 3. I think I see 10 fingers, right? Yeah, yeah. Very good. Dr. Austin Wynn, so for those of us who may not be as conversant, could you help understand more what is the difference between a nutritionist, a registered dietitian? I've seen the title RDN. And how do those differ in education, scope of practice, and usual practice settings?
Yeah, so the credentials like RD and RDN, they're the same. So the credentials RDN came later on afterwards, like years after, to help better people understand that like registered dietitians are also nutritionists, because people would be like, hey, I want to see a nutritionist, and totally not understand like what's a dietitian like at all. And so they basically are the same thing. It's just like an added letter to the credential. So some people prefer, hey, you know, I'll put the credentials RD or RDN, but they pretty much mean the same thing. And so yeah, a lot of people ask the question, hey, what's the difference between registered dietitian and a nutritionist? And so yeah, the difference in education is huge, just because in order to get the RD credentials, you have to go through schooling. And so you have to get your, at least right now, in 2020, you have to have your bachelor's degree in dietetics and nutrition. And you have to go through a clinical internship rotation, almost like how we do in PT. So it's like 1,200 hours of internship rotation, and it's in different settings. And so they basically break it up into like clinical, which a lot of times it's in the hospital settings, right? Maybe long-term care. Most dietitians end up going that route just because how the programs are set up. Others is like food service, like food service management. Other part is like community nutrition. Some people will go like to like WIC and things like that. And so after that, you have to take your boards exam. And once you pass that, you get your RD. And so that's a typical path to do that. If someone says they're a nutritionist, you don't necessarily know for sure what educational background they have, because when I was just a personal trainer without my degree yet, I was able to call myself a nutritionist, just with, you know, the course I took, which is, you know, nothing compared to a whole degree that you will get. But now, I believe pretty soon, within the next probably few years, I don't know, I forget exactly if it's 2024 or 2022. It might be 2024, but you need a master's degree at the minimum in order to go through the registered dietitian credentialing route. And so, you know, the things that is very different is, you know, from what I know and my kind of education, is that you learn a lot about conditions, pathologies, right? Food, medication, interactions, and all of that. So if someone has a certain disease or condition, you would know that the RD has learned about it, versus, you know, maybe a nutritionist, a quote unquote nutritionist. So it's just kind of a term that's been thrown around a lot. I'm not saying that, you know, nutritionists aren't educated at all. It's just that, you know, maybe you'll have certain people who've taken certain like weekend courses or certain instructors, and they could call themselves nutritionists as well, but you wouldn't know unless you dig and ask. So that's kind of like the main difference between the two.
So I'm hearing more of a really formalized, rigorous form of study for the RDs and RDNs, and the nutritionists are somebody who may have an interest or a weekend course. I think that's really more or less the in a nutshell, what's the difference between the two sides? Okay.
Yeah, in a nutshell, I mean, someone could have gone through some more like other rigorous trainings in a certain area, and I don't know, say functional medicine, integrative nutrition, and they're like, I'm a nutritionist, and they did that much. But the thing is, you never really know what route someone went through or what type of education they got until you really find out about their background. But if you know someone's an RD, then you know they had that formalized training, and they for sure learned about like medical nutrition therapy and pathologies and conditions and things like that. So you could feel really safe in that kind of aspect.
I think it's great that, you know, I mean, I guess more people pulling the general public towards better nutrition is better. But, if you have somebody who has a little bit more knowledge and education about it, that's even better. That's even more optimal. The reason why I ask is because non-communicable diseases has been identified by the WHO as the #1 leading cause of death globally. Every year, at least 5 million people die because of tobacco use, which we're trying to work on, and about 2.8 million people die from being overweight. High cholesterol accounts for 2.6 million deaths, and 7.5 million die because of high blood pressure. And correct me if I'm wrong, movement is obviously known by most physical therapists to be necessary to help beat NCDs. I think, though, that better nutrition can help achieve this goal as well. How do you think, why do you think that's so, where nutrition is such a key part on helping address NCDs?
So, yeah, like, as kind of going back to my story, when I started in the field, just kind of looking up the things that I want to do, it was always exercise and nutrition for health. It wasn't just one component. It wasn't just exercise. It wasn't just nutrition, and it was a combination of both. And the funny thing is that people could exercise and help them with their health and prevention, but you also have to watch what you eat, because I've seen a lot of people in the clinic who say they have a high BMI, they're obese, or they're not watching what they eat, and as a result, like, they've come in with high blood pressure, diabetes. You have a higher chance of getting a stroke. Just the types of food that you put in your body has a role on your health. Especially if you're overweight. I think I saw a commercial the other day. It was some stat, I forget, but it was just an obesity epidemic in the world, and in America too. Just the amount of fast and processed foods, and how your weight, your body mass index, plays a role in the statistic of your chances of you getting some sort of stroke, heart attack, all those conditions, diabetes. And it just really raises the chances for you to be able to get those NCDs. And so it's super, super important. Exercise, as is really important. We learned that in PT, but also watching what you eat. I believe you have to not only kind of take care of yourself externally on the outside with exercise, but also the things that you put in your body is going to affect how you feel, how you look, and and all of that. And so, yeah, that's why it's super important for people to do the best they can with both as best as they can.
I am of the belief as well that the more we can help the general public not need either physical therapy or dietitian or any medical services, the better it is, because it's so much better for society to be able to take care of themselves, right? Like, the general guideline I give to people who are not my patients is, well, what should I do? I always use the CDC physical activity guidelines, 150 minutes of movement every week, two times a week of strength training. And there's a website, I'm flashing right now on the screen. A similar version of that, which I think is very nice for the general population, is the choosemyplate.gov. It's a general resource that I use for my patients who have general dietary questions. Is there any particular sense or idea that you would suggest to most adults and families to take in helping them make healthier nutritional choices?
Yeah, I agree. I believe, Choose My Plate is a great starting point. It's a good resource for them to dive in and get some information on how they should probably structure their food and, their plates and for their meals. And it's a good start. But what I've seen too, a lot of times in people in PT, they have other things going on, maybe not necessarily they're the healthiest. Who knows? It depends on something, but everyone's different. And they may have certain things like going on or certain conditions, or they may have more specific questions that won't be able to be addressed by Choose My Plate. And so from that point on, and it could get into lengthy conversations, especially it's a rabbit hole. Who knows? Like, maybe they're allergic to certain foods, or they're they have particular food preferences, or they're on certain like medications, or they have a condition. And from that point on, I was like, hey, it'd probably be best if you kind of speak to a registered dietitian who kind of help you out, more than you Googling something and trying to follow the information from there. Because it really seems like you need a lot more help than that. And I'll refer them to speak with one in those cases. But, from what we have, yeah, I believe, Choose My Plate, it's a good starting resource for people to actually understand how they should break down their plates.
Right. I asked one of my patients about this question, and my general, stock answer is whole food, plant-based. I always tease them. A blueberry is a whole food, plant-based. A blueberry muffin, not anymore. It's something changed along the way. But even that, which is something as safe as I think, which is saying green leafy vegetables, one of my patients who was on renal dialysis shared that kale on certain vegetables would cause a mineral and vitamin problems for him just because of the way he cannot clear nutrients like somebody with a working kidney would. And he said to me, it's so instrumental that the registered dietitian in the dialysis center actually comes and consults. So, I love that idea where, dip your foot in the water by going to choosemyplate.gov in the absence of anything super complex. Yeah. But once you see funky things going on, reach out to an RD.
Yeah. Yeah, especially in those conditions too. It's very specific. It kind of brings me back when I used to work in clinical. So actually, when I was at PT school, I worked in the hospital as a clinical dietitian. I was doing that on the weekends, and so sometimes I would see people with renal disease, and I would be able to give them some suggestions, or at least help modify like the foods that they're getting while they're in the hospital. But usually it would be like what we call a renal dietitian, just a dietitian who specializes in those with kidney disease, who would be able to just kind of help out even more because they kind of specialize in that area. And then those very specifics, like nuances and things like that, they could help the patient further. So yeah, someone, especially in that case, I would definitely say go speak with a dietitian, because that's kind of the arena that, their specialty, what they kind of work with.
Well, that's cool. I didn't realize that there's a sub-spec in the RD world as well. You have your OCS, you have your PCFs, and it's cool that RD has the same deal.
Yeah. The only people that knows about those certifications are the ones in the professions. Yeah. So same deal. Yeah.
Same deal. Okay. So I know in the title I mentioned the Professional Dyad, and something I read about the Professional Dyad is a definition coming from a group of educators where they talked about the dyad relationship is a complex and rich with challenges and triumphs. In our experience, it is most successful when defined by our mentors working together to build more culturally relevant classrooms in early childhood education. So that's for educators and preschool teachers, right? Because when they work together, they are seemingly able to make better outcomes for students. In the same analogy, I can easily see that relationships working the same between physical therapists and registered dietitians. So just in case for the folks who are not like you, who wear both hats, what scenarios would you consider our PT colleagues to be on the lookout in our daily clinical practice? And we would say, I think this patient needs to become a registered dietitian referral. What kind of scenarios would we be watching out for?
Yeah, so I think a lot of scenarios when, the conversations go beyond just eat, half your plate of fruits and vegetables and stay away from all the fast foods, and it goes more in depth, or you don't have as much time, or the person needs a lot of help, it needs a lot of guidance, maybe coaching, needs some more individual attention that what you could provide like in the clinic, and things like that. If you know that, then I would say, hey, you know what, maybe best for you to work with a registered dietitian. And it could be many different scenarios. It could be for someone who's overweight, and maybe they're like, oh, I've been trying, but I'm having a difficult time trying to do this on my own, or I'm so confused on exactly like what to do. Or maybe say it could be someone totally opposite and say maybe it's more for like sports performance, and they're more of an athlete, and they're trying to do some competitions or training events, and they want to help better fuel themselves, and they just want, you know, maybe more of a structured plan or like guidance like on that more than the time you could probably spend with them in the clinic. They might be like, hey, like maybe you go work with a dietitian so this would be like a sports dietitian, or someone who kind of
another subspecialty.
Exactly. Yeah, another subspecialty. Because you know, all dietitians, like we learn, just like PT, like we learn about it all, but not every PT wants to do every single thing, or maybe what PT likes a certain area, a subspecialty, like in PT, like maybe one likes orthopedics, right? And maybe one likes neuro. So depending on who you are, it's like you would refer them out.
If a pediatric patient stepped into my front door, I would like, I don't know what to do here.
Yeah, me too. I'm like, yeah, I learned that in school.
Oh, hold on, let me find you somebody I know. Right. I get
it. I'm the same way. I wouldn't be like, okay, here, let me pull out my textbook and then like remember some stuff and then help you out. Same thing. I would be like, hey, like you maybe go talk to a peds dietitian that just works with, you know, people in those age ranges. So like someone could be just a general dietitian, but if someone, you know, has a special interest in a certain area, and I'd be like, hey, well, maybe you could work with this person. Or maybe I had some people before who in the clinic, and say I was working with them for low back pain, and they also had some like digestional issues. They had like IBS or whatever, right? And I'm like, hey, you know what? I know dietitian. You could probably work with this person like for this, while I kind of help you with that, and then just kind of what you're talking about, the whole dyad, like we're getting the best of both worlds. So we're helping them internally and then externally, like as well. And so those situations too, like anything where it comes up and maybe it's beyond the general guidelines, or it's just gonna take maybe more time than you have, or go well beyond anything that you may know, and you want to make sure you don't say anything wrong under like your license with the education that you have. I just be like, hey, just go, go speak with a dietitian, and they could work with you on this while I help you with, your particular problem. And that's pretty much the approach I've been taking, because I realized I couldn't do everything, and time is very limited too in the clinic, depending which type of clinics you work at. So when I was working in California at a clinic there, I had a little bit more time. I had patients where I'll see for 1 hour, so I could chit chat a little bit more, and I could kind of give some advice while we're doing with PT. But sometimes I saw that some conversations take longer than others, and we're here for PT, and like it was okay. I could get away with some stuff, but I still referred out when I can, just to kind of save me time, but help them the most because they could get more guidance, more follow up on that particular problem. Over here, when I moved to Orlando about a year ago, so the clinic I'm working at right now, we have about 30-minute sessions, 30 to 40. And so it goes by quick. I hardly have time to kind of talk about other things because I'm trying to focus on.
You can't do your PT hat and your dietitian at the same time.
And
do well. You want to do well in either one, but you can't do both at the same time.
Yeah, you have to do well. Everything takes time. Like that's what really, everything takes time, and you need to put attention to each certain issues. And so I can't do both. And so at that point, I'm just like, hey, you know what? I think it'd be best to work with some dietitians I know who understand kind of what you're going through, and maybe in your particular spot of you being injured, they can help you accelerate your recovery from an injury, and then I'll be working on this part with you, right? And so sounds good, cool, and we'll all work together. So in those cases, that's normally what I say and what I would do.
If we identify a patient that needs a registered dietitian services, invariably the question will come up is, will my insurance cover this? So do you have any idea what kind of situations insurance would and would not cover RD services?
Yeah, I have a general idea. I mean, like for the most part, from what I know, is that insurances will only cover certain conditions or diagnoses. It's not like they'll just cover everything, or just, I know it depends on your insurance policy, but in general, it's something like, hey, if you have diabetes, if you have high cholesterol, if you have kidney disease, then we will cover it. You have renal disease, okay, well, we'll give some coverage. But probably other things from the stuff that we mentioned, this episode, like probably not, but it's more like diagnosis specific. And so like that's from what I know. I haven't worked with insurance specifically for nutrition and things like that. But yeah, there are others who just really want to take care of their problem, and are willing to pay out of pocket for the service. So that's how I go about it.
I see. So there are some conditions that are covered by insurance, and there's also some a segment of our population that will realize that paying out of pocket or cash for the service is valuable enough. So we have to be on the lookout for both populations.
Yeah, exactly. Yeah.
Okay. So we're gonna delve here in the realm of a bit of Asian culture. As a birthday treat, my wife and I, who are both Filipino American heritage, she gave herself a birthday cheat meal of fried ham hock or pork hock, or in the Filipino language,
Sisig?
pata.
It's
That
okay.
big chunk of pork leg that is marinated and deep fried. So think this unending supply of chicharrones or pork rinds, right? And I have to tell you, finding the RDA values of that particular segment was harder to find in the ChooseMyPlate.com. With the N of 2 in our household, we were using something called the PT Health Study to track our stress, our sleep, our overall wellness. And we saw that the night of and for 2 days after eating that giant pack of fried food, we had this really big drop in lethargy and energy and poor sleep. Is there anything we know in the literature that correlates like really unhealthy food and how it affects the body very quickly?
Yeah, like I wouldn't be able to cite any specific studies, but like what we learned is, foods like the way you eat and your diet could affect your sleep patterns as well. What's the whole evidence and specifics on that? Like I would have to look in to see, hey, are there any specific material that shows that's proven? But there is a big correlation. And so any foods that are more higher in saturated fat, like the big chicharrones meal that you described, right? And like lower in fiber, definitely could affect your sleep quality, and you just have more sleep arousal. So you won't sleep as well and deep as you would as if you had like a healthy meal. And people feel it. So, you feel it, you felt it like right away. Like, oh, why is that? So yeah, there is a correlation between the foods that you eat and your sleep quality. And so, yeah, it just depends on, if you're having a lot of greasy foods, which is a whole bunch of saturated fat. And, a lot of times when people eat that, they also feel a little bit, afterwards, maybe not digesting as well. It's kind of a little, just like a little gunky feeling in the stomach after a while, like, okay, don't sleep as good. And so, yeah, there's a correlation. And so like you notice it just with the N of 2. And so, yeah, the way you eat and what you put in your body will affect how you sleep, stress levels and stuff, etc.
The a Thai dish I love is the classic chicken pad Thai, the Filipino dish of adobo, and the Korean dish of sundubu. And these three Asian dishes correspondingly use nampla or the fish sauce. And check out the sodium stats on that one.
Oh, yeah. Don't go more than a teaspoon.
Exactly. And I tell you, this is how Filipinos. Yeah, exactly. And then, what do you call this? The sesame oil, which again, in sparingly, and soy sauce. So I guess that's the challenge for regional and ethnic cuisine is how do we balance that flavor profile and that which makes ethnic cuisine so popular versus the admittedly, not too great nutritional profile of some dishes. What can you suggest to folks who are trying or using a lot of that stuff to be a little healthier with their food?
Yeah, so it's a good question. Funny thing is that's kind of how I grew up, right? With those similar kind of foods, those Asian ethnic foods, and that's why I was like, what can I do to become healthy, right? It's like so much sodium and so much carbs, rice, and then meat, no vegetables. So that was like kind of me trying to figure out what things for myself, so I could kind of help guide like other people. And so I started to try to change the taste I was used to. So that the saltiness of, the sauce, the soy sauce or the napla, all of that, I would slowly try to add less, right? So kind of when I tell people, hey, change your taste, you could slim your waist.
Harm reduction. So you didn't completely eliminate it. You just maybe did a little less and less and less until your taste buds adjusted.
Yeah.
Oh,
And
okay.
then once you do that for a while, you definitely pick up like how salty some foods could be if you haven't had such that intensity for a while, right? And you kind of have a better, I guess I would say, recognition for it, and you're like, all right, well, okay, I probably didn't need as much sodium or soy sauce as I thought before. And I would mix around like different ingredients and say, okay, instead of maybe putting this, maybe I could add some of these other items that maybe have less sodium. Maybe I don't need as much of the carbs, and maybe I could change my plate into, instead of having 2 mountains of rice on my plate, maybe I'll start off with like 1 or half, put a little more protein in there, and maybe I'll put some kind of veggies on the side to kind of help out with that. And slowly I would kind of start shifting the way I eat and like my patterns. But I wouldn't completely avoid the foods. I would just kind of I would change up the routine so I'm not having those type of foods every single day, until the point where I get comfortable saying like, okay, I have good control on the way I eat, the patterns I eat, and it's okay if I have those certain foods, but I'm not eating like that every single day. And just slowly over time, just kind of changing my taste buds around that. But don't get me wrong, it's funny. So I'm going right after this, I'm driving down south, and my girlfriend's Filipino, and so
okay.
she hasn't had Filipino food in a while. And there's
lucky
a Filipino,
you, I think.
Lucky me. So we're gonna try some Filipino food when we go down there to a spot that I know of, and I haven't had it for so long. But I'm like, okay, cool. It would be like a little treat, just kind of how you had for the birthday weekend, But it's not like I'm having those type of foods every single day, where that's how it was when I grew up. And so now it's a little different. I started changing. Like I remember in the beginning was like, okay, well, let me start doing brown rice, a little more fiber, and trying to kind of get used to that. A little bit less sauce, the salsa ones, right? Or, on top of a little bit less, right? And that's how I went. So small adjustments over time, and trying to switch certain things out for other ingredients that could be a healthier alternative is kind of like my approach and kind of what I tell other people to do.
That is great advice, man. Culturally, I think, like me, my read on Filipino culture is the reason why we have so much flavoring and so much saltiness in our foods is rice is very bland. It's a very neutral flavor. So to give it some oomph, you would use that, what do you call this? You would use those intense flavors to give some liveliness to your bland rice. And listen, you can have 2 giant mounds of rice if you still were working the fields, just like my ancestors were back in the Philippines, which was a very agricultural country. I think some of us, my Filipino brothers and sisters, get in trouble is if their rice consumption is still at that level where they're working very labor intensive work, and working 4 hours in the field planting rice is not quite the same energy expenditure as, say, typing in front of a computer for 4 hours because you're working from home.
That's right.
Yeah. So if any of our PT colleagues would like to learn more about your work as an advocate for both the nutritional and movement needs of our patients, how could they contact you, and what resources can they reach out to be able to do more?
Yeah, so anyone, you find me on Instagram, Dr. Austin Nguyen. You could find me on Facebook, Austin Nguyen. You could add me, send me a friend request, send me a message, whatever you want. But I do have resources that I've created for patients, kind of going back to what I talked about earlier, like me finding it really difficult to wear 2 hats at once. And so what I did was kind of create some resources for certain patients, some ebooks, like my book, different things. But I did do something I remember like a while back for some PTs to at least maybe get a handout of something, of a general handout to give to patients if they have certain questions. There's definitely a lot more, but that one they could find at foodandpt.com. It's just I believe like top 15 health tips if they're in PT and want some help with their nutrition. So some just basic things, and those are some things like we kind of cover and do, but it's a good start. And so if anyone wanted to look at that, they could go foodandpt.com. But if they want to connect with me or anything like that, just find me online, Facebook, Instagram.
Oh, thank you for joining me today, Dr. Austin Wynn, to discuss issues around movement and nutrition and the potential collaboration between RDs and PTs. It's been my pleasure to speak with you today and learning with the audience so much more about the relationship between movement and nutrition. And your insights have given us greater awareness on how we can better serve our patients, and we are very appreciative of your time and your knowledge sharing.
All right, it was awesome being on here. Thank you so much.
Thank you so much.
Thank you for listening today to the Life in Motion podcast. Striving for excellence doesn't demand perfection. Just be a little better in all that we do than yesterday. This is Ben Aguila. Till our next episode. God bless.